Have you ever wondered how getting sick could ruin your life, not because of the illness itself, but because of the bill? This is America. And here, healthcare isn't about health. It's about money. Every year, more than 100 million Americans struggle with medical debt. 2 out of every 5 adults owe hospitals, doctors, and insurers money for care they already receive. Or worse, care they had to skip. In this video, we'll explore why in the wealthiest country in the world, getting sick is the fastest way to go bankrupt. Let's begin. Imagine waking up with chest pain. You're scared. You go to the emergency room. They stabilize you. You're discharged within 24 hours. Weeks later, the bill arrives. It's $38,000. You had insurance. But your deductible was $6,000. The hospital was out of network. You now owe money you simply don't have. This isn't rare, it's standard. But how did we get here? In most developed countries, healthcare is a public service. In America, it's a business. Hospitals charge whatever they want. Insurance companies negotiate discounts for their customers. But if you're uninsured, or treated at an out-of-network facility, you're charged the full, inflated price. Even insured patients face sky-high deductibles, copays, and surprise bills. Let's break it down. An ambulance ride can cost $3,000 to $5,000. An overnight stay? Easily $10,000. A simple MRI scan? $4,000 or more. And if you can't pay? The bill is sold to debt collectors. They can garnish your wages, seize your tax refunds, damage your credit for years. All because you needed care. But the system goes deeper. Nonprofit hospitals, those supposed to serve the public, often sue patients over unpaid bills. They garnish paychecks from minimum wage workers. They place liens on homes, all while sitting on millions in tax-free assets. Insurance companies, meanwhile, deny claims for necessary treatments. Patients find themselves arguing on the phone for weeks, begging to receive care their doctors say they need. And if care is denied, you're on your own. Consider insulin. In America, a vial of insulin can cost over $300. In Canada, around $30. People are dying from rationing insulin, in a country where life-saving medicine exists on every pharmacy shelf. Parents crowdfund online just to pay for their children's chemotherapy. Cancer patients post GoFundMe links, because their insurance doesn't cover enough. This is the reality. And it's breaking people. But this isn't accidental. It's structural. Healthcare lobbyists spend millions every year to block reforms. Hospitals profit from opacity. Insurance companies profit from denials. Pharmaceutical giants profit from monopolies. The result? An American healthcare system where profit comes before patients. Let's talk about the victims. There's Lisa, a single mother who delayed seeking treatment for a toothache because of cost. It turned into a jaw infection. She spent 10 days in the hospital. The bill? $86,000. There's Mike, a truck driver with no insurance, who ignored flu symptoms. They escalated into pneumonia. He needed ICU care. He lost his savings and his home to cover the $120,000 bill. And there's Emily, a nurse, who had a stroke in her 30s. Her employer provided insurance covered the hospital stay, but not the 6 months of therapy she needed. She maxed out credit cards just to walk again. These stories are everywhere. And yet, the system doesn't change. Because it's working. Not for patients, but for corporations. The average CEO of a major health insurance company earns more than $20 million per year. While everyday Americans skip appointments to avoid bills they can't afford. Now, what can be done? Some states are expanding Medicaid to cover more low-income people. Some hospitals have charity care programs, but they don't advertise them. Organizations like rip medical debt by and erase people's bills for pennies on the dollar. But these are patches on a system that's bleeding people dry. Real reform would mean regulating hospital prices, capping out-of-pocket costs, making insurance cover what people actually need, and holding corporations accountable. But as long as money controls policy, change remains slow. So what can you, the patient, do? First, request itemized bills. Hospitals often overcharge, hoping patients won't notice. Second, apply for financial assistance, even after receiving care. Many hospitals quietly offer help but require paperwork. Third, consult patient advocates or billing experts when facing large charges. Fourth, speak up. Share your story. Because silence is how they win. Millions are suffering alone, believing they failed. But the truth is, they were failed. Failed by a system designed to profit from sickness. In closing, remember, if you've ever felt alone, scared, or ashamed of medical debt, you're not the problem. The system is. This is Health Broke. Share this video. Subscribe for stories they don't want you to hear. And together, let's fight for the right to heal, without going broke.